Good morning, Dr. Adeli. My name is Christina Nicholas, and I will be presenting our case study for Group 1. And the case study reads, a mother took her only child, a 2-month-old baby boy, to the Princess Margaret Hospital, stating that he has been having recurrent seizures and has a bluish color skin. She told the doctors that the seizures were brief in nature and throughout the day, and that to the best of her knowledge, the newborn baby was not allergic to anything and was not on any medications, and the family members does not have any family history of seizures. Now, during the physical assessment, the doctors noticed that the baby had a very small jaw, short with hooded eyes, lowered ears, and very thin upper lip. There was no fever or other symptoms suggestive of central nervous system infection. His neurological examination was normal. The doctors ran a few tests and found that a test called fluorescent in situ hybridization, better known as FISH, came back positive. Auscultation revealed a systolic murmur at left upper sternal edge. The lab investigation showed hypocalcemia, hyperphosphatemia, and low parathyroid hormone level. A narrow superior mediastinum was seen on the chest radiography. Ultrasonography showed an absent thymus in the anterior mediastinum. Echocardiography revealed an ostium secundum atrial septal defect, better known as ASD. Kidney and brain ultrasound were normal. Now, our group would like to ask, what is the most appropriate next step that would assist the mother and her baby? A. To prepare for heart surgery. B. Start calcium replacement therapy combined with active vitamin D. C. Request more tests. D. Send the patient home to monitor the seizures and return in 2 weeks. Now, the most appropriate answer would be B, which means we start the baby with calcium therapy and combine with active vitamin D. My answer for saying this is because we've seen that the baby is very low in calcium. Baby cannot really produce enough calcium level. It would be best to assist the baby with calcium therapy and active vitamin D supplements. Now, saying that the baby has low or no immune system, this is a major cause of DIGERS syndrome, which is a form of skin, and this doesn't really have a cure, but it has treatments. So therefore, the immediate recommendation for now would be to start the baby on calcium therapy and active vitamin D supplements, so that the seizures would be able to be calm and subside. So after stabilizing the patient and getting the seizures under control, the doctors can look also into corrective heart surgery. The doctors can also perform a bone marrow transplant, which I think is the best thing that the baby will need. This will be able to help the baby to live a normal and longer life. Enzyme therapy can also be another option. The enzyme therapy is also called IVIG, which means intravenous immune globulin or gamma globulin treatments. So these treatments normally helps to boost the child's immune system and treating each infection